So I wrote takeaways for physicians, and I think that's important because physicians are humans too. They're part of the encounter. Nobody in their right mind goes into medical school and says, I want to be burnt out and I want to look at medical records all day and not remember my patient's names. I mean, no. You aim to have a connection and you aim to help people. And then you're in a system where you have very little time to see your patient and you're like, yeah, I'm listening, you know, what's your name? Or you don't even ask because you don't have the time. And that's frustrating for them as well. And when they need to explain things, when they need to explain diabetes, I mean, it doesn't have to be completely earth-shattering and just ruin your world completely. It can just be a relatively benign chronic condition. Try explaining diabetes for the 5th time that day. Try explaining medicine and science very quickly. Try explaining probabilities. It's hard, it's frustrating. They need help. Doctors need help. That's why I wrote about takeaways for physicians. And then I thought, it took you a long time to get there, didn't it? Because my master's I did on organizational psychology, and I sort of obliterated that. And I kind of thought, I made a mistake. As a psychologist, we sometimes focus on the person, but the person is a person in an interaction, and the interaction takes place within a system. So the system allots 5 minutes for me to talk to if I'm your doctor and asks me to do this. What sort of a relationship are we going to have? A pretty crappy relationship, dare I say, because this is not conducive to any sense of care, any semblance of care. So the systems in which we work and have our medical encounters should also care. Now, I'm not naive. I mean, a little bit at heart, yes, but when I wanted to talk to medical systems, I made a point of putting down the ROI. Like saying, don't do this because you care about the patient. Don't do this because you care about the doctors. Seriously, who cares about anybody anymore? You care about your organization. You care about the bottom line. You care about satisfaction ratings. You care about people coming back to see the same doctor, bringing in more money. You care about not being sued. Oh, that's a big ticket item. So don't do this because I asked you to, and don't do this because you're nice. Do this because it's worthwhile for the system. For example, if you waste your physician's time in explaining things, waste less time. Help them convey information in a way that's more useful. And I spoke with a doctor once. He said when he was training, the physician he trained with had, as he called it, the room that didn't make any money. So the room that didn't make any money was just the room with the educational materials. But in a way, I think that's a room that makes a lot of money because what you spend on it is minimal. And what you're doing is you're allowing patients to absorb some information in their own time, hopefully in a way that they understand. They're less angry with the doctor. They're less likely to just pursue another visit for informational purposes, which frustrates everybody. And that's the sort of thing that I want and hope for medical systems to do. And you know, we'll talk about it more specifically. I'm sure if you ever want to talk about probabilities, which you know something about.
We'll get on to